Welcome, and thank you for the opportunity to share our experience. My name is Dr. John Olsofka, and I am truly excited to share with you the latest technology in the treatment of obesity, the Orbera gastric balloon. Yes, this is it. Finally something new in the battle. What a revolutionary change, considering what's out there now. FDA approved, non-surgical, outpatient, no downtime from work, no reason to tell anyone it's there unless you want them to know. My partner, Dr. Vincent Lusko, and myself have developed a comprehensive bariatric program and have been truly honored to be one of the first 10 sites to be trained in this new technology. Why, you may ask? Well, 10 years of lap bands and 4,000 procedures to date. And we see every patient every time in follow-up. Your journey is our quest. We want you to win. And we feel we can bring the Orbera gastric balloon to the forefront of weight management and help you be successful. I want to walk you through this procedure and educate you to have a solid understanding of the gastric balloon, the aftercare, and the reality of long-term success. I want you to understand the options that we offer and understand the benefits of the balloon and the potential of the long-term possibility with the lap band. Let's get started.
So experience is important. We started our program in 2003, and to date, Dr. Lusko and myself have performed well over 4,000 bariatric procedures, mainly the lap band. We've developed an extensive aftercare program with lifelong physician contact, and we are going to do the same for the gastric balloon. So let's get started with the gastric balloon, a new managed weight loss system. We're going to define the treatment options for obesity. We're going to look at the gastric balloon in some detail and what you should expect. We're going to look at some real success stories. And then we're going to investigate lap band as an option. Well, how do we compare apples to apples? We use what's called the body mass index, or BMI. Basically, this is a formula that generates a number, the BMI, using the height and the weight of the patient. It is that area in yellow that is most suitable for the gastric balloon. If we look at that in comparison, a normal BMI is 25 or less. You're considered overweight up to a 30 BMI. And then obesity kicks in at a BMI of 30 or greater. Why is this important? Because this is where the other comorbidities come into play. Hypertension, diabetes, joint pain, gastroesophageal reflux disease. A BMI of 30 is still considered obese and can have those impacts, both social, economic, and health. Well, there are different options for weight loss: diet and exercise, medication, and surgery. But it's that area between pharmaceutical and surgery that the balloon fits in. We will also investigate how this is also an excellent area for the lap band for patients with a body mass index greater than 30. You now have, as mentioned, a new non-surgical, minimally invasive option for weight loss. Well, let's take a closer look on what this is about. The gastric balloon is a comprehensive two-part program, starting with a soft silicone balloon placed in the stomach for 6 months. This is used to encourage portion control. We also have a team that's been developed as a support network for every phase of the procedure. And then there's education and training. We will look at why the balloon, or the gastric balloon, is not a permanent solution, but we want to educate and train so that you can continue to maintain your weight loss. Well, how does Orbera work? Basically, it's placed within the stomach endoscopically and takes up approximately 1/3 of the space of your stomach. It helps you feel full. We don't eat when we're full. Everyone knows what it's like to eat that big meal, and for a brief period of time, we go through our minds how we'll never eat again. Well, then that stimulation is gone as the food moves out of the stomach. What the balloon does is maintain that stimulation so we eat smaller meals less frequently. It's been shown that using the gastric balloon can help an individual lose over 3 times the weight they would lose with a typical diet and exercise program. And that can be significant. If you think about a good regimen over 6 months, if you were to lose 10 pounds with diet and exercise alone, the Orbera balloon has the potential of 3 times that, or greater than 30 pounds. If you think you could lose 20 pounds with diet and exercise, you can definitely see the potential. So as mentioned, you can expect to lose 3 times the weight as you would with the diet and exercise program alone. The other positive factor is that it works right away. As soon as this is placed, you're going to start seeing results. And if you look how the procedure is actually done, it is done endoscopically or with a scope under light sedation. The balloon is placed into the stomach and then inflated. And you can see by this video how the balloon acts to take up space and stimulate that feeling of fullness. The entire procedure to place the balloon takes approximately 20 minutes, and you go home the same day. The gastric balloon is removed after 6 months. We cannot leave a foreign body within the stomach longer than that without having complications. It is again a non-surgical procedure to remove the balloon and is an outpatient procedure with no downtime from work. Well, how is life with the balloon? I can tell you that nothing in life is free. Sometimes it takes a little effort, and the first week with Orbera will be challenging. Basically, you're going to get that feeling that you just left the buffet, but that only lasts for approximately a week, sometimes 2 weeks. You'll have some nausea, you may have some vomiting, and you may have some abdominal discomfort. We have medications to treat that, and you will receive those medications prior to leaving from the procedure. It is a regimented medication protocol that really does help eliminate these symptoms. Now, as we know, this is a temporary procedure, so long-term weight loss requires lifestyle modification or behavior modification. So if we look at life with the Orbera balloon or with the lap band, it is an interaction between diet, exercise, and of course coaching and training. And we're here for the long term. Your program with the gastric balloon is not just the 6 months that you have the balloon in place, but more the entire year after placement. We want you to continue with long-term weight loss. So training and education is important. After placement of the balloon, you will have regular scheduled meetings with the physician or nutritionist or other members of our team to develop long-term sustainable healthy habits that will allow you to keep the weight off. Well, real-world experience. You know, the balloon has only been improved in the United States since 2015, but over 220,000 balloons have been placed nationwide in over 80 countries. It's been evaluated with over 230 clinical publications. We know that this works, and its time has come in the United States. Well, real-world results. James lost over 37 pounds with the gastric balloon. He's able to get around better, get into his car better, exercise more, and is involved in more activities. Well, Angela, again, real-world results, has lost 48 pounds. Basically, she wanted to get back into the clothes that she wore at an earlier date, and she was successful with this and very happy with her results. Well, our team will work with you to change your life. 24-hour support for the first week as you're going through with the nausea and vomiting. The aftercare support with bi-weekly and monthly visits with the dietitian. You'll also be seeing Dr. Lusko and I in our office. And we will provide fitness counseling and evaluation over the long term. So what is the cost of the gastric balloon? Currently, the procedure is not covered by insurances, and I doubt that that will change anytime soon. The cost does cover an all-inclusive weight management program. It covers balloon placement and removal, the aftercare program, and of course, access to our team. The cost is fluctuating as we continue to try to lower cost by increasing efficiency. We also work with American Healthcare Lending. They have been working with us with the lap band as well as general surgery. They have in the past helped with co-payments and deductibles and are willing and able to help out with the gastric balloon. It's a simple online application and can be improved very quickly, and there's no down payment. So is the Orbera gastric balloon right for you? While the balloon does not require surgery, any medical procedure requires careful thought and consideration. In review, the qualifications for Orbera are as follows. You must be older than 18 years of age, and the current approved body mass index is between 30 and 40 BMI. I don't doubt that that will change in the future to go to actually a lower BMI and possibly be used up to a BMI of 50. You must be willing to participate in a medically supervised program. Basically, you must be committed to change. Well, let's look at the Orbera Advantage. It's been proven to deliver better weight loss than diet and exercise alone. As you remember, over 3 times the weight loss. It's a non-surgical procedure placed as an outpatient. It does not require long-term drug therapy. It helps you eat smaller meals and learn proper portion control. And it's supported by a team of medical experts, as well as nutritionists, nurses, and physical therapists. We are going to teach good eating habits and lifestyle changes for long-term success. In summary, it's a comprehensive 2-part program as we mentioned. You have the placement and then after 6 months, the removal of the balloon. We have a team of experts in every aspect of care, both dietitians, psychologists, exercise physiologists, and physicians. And we will work to educate you and train you, not only in the use of the balloon to be successful, but then long-term to maintain your weight loss. Now let's take a step back and look at the lap band and how that compares to the gastric balloon. Certainly in our program, we have had great success with the lap band, as I mentioned, doing well over 4,000 procedures. We continue to do approximately 8 to 10 procedures a week and really do believe in the lap band and its benefits. It is performed laparoscopically and is an outpatient. It takes approximately 40 minutes to place the band, and then you go home afterwards. There is no stomach amputation or cutting or rerouting of the intestines. It can be adjusted over time. It's individualized for the patient's needs. And you meet with us, the physician, at every visit. It's designed for long-term use. This is meant to be permanent and is meant for behavioral change for long-term success. It has excellent long-term success when used in conjunction with a strong aftercare program. And basically, this is what it involves. It involves placing the band around the top portion of the stomach. This creates a small pouch. For when you eat, that pouch fills and stimulates that feeling of satiety or feeling full. We then adjust the band in the office to allow that food to empty from that pouch in a gradual fashion. This allows you to stay satisfied and not become hungry till your next meal. Thus you take in fewer calories and you remain satisfied and avoid the snacking behavior between meals. The band needs to be adjusted on a periodic basis, on average about 4 times the first year and then 2 to 3 times the next year. And then you pretty much reach a status quo. We meet with you at every adjustment to discuss your progress. Well, why would you choose the lap band? Well, it is certainly an effective tool to help achieve long-term weight loss. You have the power to change your lifestyle and behaviors and use the lap band as a tool. And you have long-term access to the program with extensive experience and tools for success. And also, it is covered by most insurance plans. So with a cost comparison, we look at the gastric balloon. We remember that it is not currently covered by insurance. However, the cost does cover an all-inclusive program of placement, removal, aftercare, and access to our team of experts. The lap band, in contrast, is covered by insurance and is a long-term management and aftercare program. And we have extensive experience, and we want to share that for your best success. Well, is the balloon right for you, or is the lap band right for you? As mentioned previous, to receive the gastric balloon, you must be 18 years or older, and that is the same with the lap band. The Orbera balloon has a relatively narrow BMI for which it is approved, a BMI of 30 to 40, whereas the lap band is approved for a BMI greater than 30 to infinity. Generally, for lap band, the insurance does not cover a BMI less than 35. It is, however, FDA approved, as mentioned, for a BMI greater than 30. You must be willing to participate in a medically supervised program, and that's basically true for both procedures. If you stay engaged with the program, basically you're using the balloon or the band as a tool, and we can help you maximize your success. You have to recognize with the balloon, however, that it is temporary, and long-term weight loss success is dependent on your dedication and your behavioral change afterwards. With the lap band, you have to be willing and able to return for adjustments and stay engaged in the program. So when we go back to our scale of normal BMI, obese, and severely obese, basically this is that gray zone, both candidates for the balloon and for the band. And we would be happy to discuss both options with you as you meet with the physician. You are welcome to call the program or go to lapbandoflouisville.com and review a much more in-depth seminar. So what is the next step? Well, you can fill out the application that's on the website and send it directly to our office. You can print it out, fax it, or email. You can call the office directly, 502-361-6059. And if you need any more information on the lap band, go to lapbandoflouisville.com.
Well, there you have it. Whether you choose the gastric balloon or the lap band, Dr. Lusko and I are here to help, and we want you to be successful. Thank you for this opportunity.